Welcome to Ulosca channel. Access all nursing practice questions. Nursing Services Childbearing Practice Questions with Answers.
Question 1. A nurse is assessing a client who is at 36 weeks of gestation. Which of the following findings should the nurse report to the provider? A. Reports of frequent urination. B. Mild lower back pain. C. Blurred vision and headache. D. Fetal movements 10 times in 2 hours. Which one is the correct answer? The correct answer is C. Blurred vision and headache. Explanation. Blurred vision and headache are potential signs of preeclampsia, a hypertensive disorder in pregnancy that can lead to serious complications if not treated. The other symptoms are common and usually not alarming at 36 weeks. Question 2. Which hormone is primarily responsible for maintaining the uterine lining in early pregnancy? A. Estrogen. B. Oxytocin. C. Human chorionic gonadotropin. D. Progesterone. Which one is the correct answer? The correct answer is D. Progesterone. Explanation. Progesterone plays a key role in supporting the endometrium to nourish the embryo and prevent uterine contractions that could lead to miscarriage. While HCG sustains progesterone production early on, progesterone is the direct hormone responsible for lining maintenance. Question 3. A nurse is caring for a client in labor who is experiencing late decelerations. What is the priority nursing action? A. Increase fluids. B. Turn the client to a side-lying position. C. Administer oxygen. D. Notify the provider. Which one is the correct answer? The correct answer is B. Turn the client to a sideline position. Explanation. Late decelerations indicate uteroplacental insufficiency. The priority intervention is to reposition the mother to improve placental blood flow. Other actions may follow, but this is the first and most effective immediate step. Question 4. What is the recommended schedule for Rh immune globulin administration during pregnancy? A. At 16 weeks and again at 30 weeks. B. At 28 weeks and within 72 hours postpartum if the infant is Rh positive. C. Only postpartum. D. Monthly after 20 weeks gestation. Which one is the correct answer? The correct answer is B. At 28 weeks and within 72 hours postpartum if the infant is Rh positive. Explanation. Rh immune globulin is administered to Rh negative mothers at 28 weeks and again after delivery if the baby is Rh positive to prevent maternal sensitization and hemolytic disease in future pregnancies. Question 5. Which of the following newborn findings requires immediate intervention? A. Acrocyanosis. B. Jitteriness. C. Presence of lanugo. D. Overlapping cranial sutures. Which one is the correct answer? The correct answer is B. Jitteriness. Explanation. Jitteriness in a newborn may indicate hypoglycemia or neurologic dysfunction and requires urgent evaluation. The other options are typical and generally not concerning in the immediate newborn period. Question 6. A nurse is reinforcing teaching with a client about breastfeeding. Which statement by the client indicates a need for further teaching? A. I will wake my baby to feed every 3 hours during the day. B. I should feed my baby for at least 20 minutes on each breast. C. If my baby falls asleep during feeding, I'll stop immediately. D. I should look for signs that my baby is swallowing. Which one is the correct answer? The correct answer is C. If my baby falls asleep during feeding, I'll stop immediately. Explanation. If a baby falls asleep during feeding, the mother should try to gently arouse the baby to ensure adequate nutrition. Stopping too soon can interfere with proper intake, especially the higher fat hind milk needed for growth. Question 7. A client at 39 weeks gestation reports a sudden gush of fluid from the vagina. What is the priority nursing action? A. Check the fetal heart rate. B. Perform a sterile vaginal exam. C. Administer oxygen. D. Insert in 4-line. Which one is the correct answer? The correct answer is A. Check the fetal heart rate. Explanation. The priority is to assess fetal heart rate to rule out umbilical cord prolapse or other complications that could compromise fetal well-being. This determines next actions quickly. Question 8. Which prenatal laboratory finding would require follow-up? A. Hemoglobin 12.5 GDL. B. WBC count 9,000 mm superscript 3. C. Platelet count 100,000 mm superscript 3. D. Blood type and negative. Which one is the correct answer? The correct answer is C. Platelet count 100,000 mm superscript 3. Explanation. A platelet count of 100,000 is below the normal range and increases bleeding risk. It may indicate gestational thrombocytopenia or more serious conditions like HELLP syndrome and should be investigated. Question 9. A nurse is reviewing safe sleep practices with a new mother. Which statement by the client demonstrates understanding? A. I will place my baby on their stomach to sleep. B. I will use a soft pillow under my baby's head. C. I will keep stuffed animals in the crib. D. I will place my baby on their back to sleep. Which one is the correct answer? The correct answer is D. I will place my baby on their back to sleep. Explanation. Placing babies on their backs is the safest sleep position and has been shown to reduce the risk of sudden infant death syndrome. Soft bedding and stuffed toys increase suffocation risk. Question 10. Which of the following is an expected finding in a postpartum client on day 2 after delivery? A. Fundus 2 centimeters above the umbilicus. B. Bright red lochia rubra. C. No lochia present. D. Boggy uterus. Which one is the correct answer? The correct answer is B. Bright red lochia rubra. Explanation. Lochia rubra is expected within the first 3 days postpartum. A boggy uterus is a sign of uterine atony and a risk for hemorrhage, which would require urgent intervention.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.